This video demonstrates how to add preprint citations to MyBibliography. The National Institutes of Health encourages investigators to post preprints to public repositories in order to speed the dissemination and enhance the rigor of their work. And it's now easier than ever to add preprint citations to MyBibliography, and when applicable, claim them as products of NIH funding. Start by clicking on Add Citations from the MyBib top-level options and selecting Manually. The resulting pop-up window includes a drop-down menu to select the type of citation you wish to add. Preprint is now one of the listed options. Here is a filled-in example. A preprint citation requires that you provide at a minimum the title of the work, at least one author, the date the preprint was posted publicly, and the name of the repository it was posted to, for example, bioRxiv, arXiv, Zenodo, or as in this case, OSF preprints. A unique ID is not required for a preprint citation, although inclusion of a Digital Object Identifier, or DOI, is strongly encouraged when available. Recognizing that preprints may be updated in response to feedback or to reflect new findings, you can also include a revision date and supply a version number for tracking your citations. Once you save the citation to your bibliography, it will be included alongside your other publications, with the designation preprint in brackets. If the work reported in the preprint was supported by an NIH grant, you can select Add Award to ensure that the preprint is recognized as a product of your award and can be reported to NIH accordingly. If a preprint or a later version of the preprint is accepted for publication in a journal, you do not need to delete the earlier preprint citation from MyBib. Simply add the journal article as a new entry so that both products are listed. A few reminders for NIH awardees. You are not required to post preprints, though if you choose to do so, the NIH strongly encourages you to select a Creative Commons attribution license, or dedicate your work to the public domain in order to maximize the impact of the work. You also are asked, in the text of the preprint, to acknowledge NIH funding, clearly state that the work is not peer-reviewed, and declare any competing interests, as you would do for a journal article. For more guidance on claiming preprints as products of award, or selecting preprint repositories, see the NIH Guide Notice, NOT-OD-17-050. And please send your questions about adding preprints in MyBibliography to nlm-support@nlm.nih.gov.